Hello, everybody. Welcome back to another session of our COVID-19 community conversations hosted by UW Medicine Office of Healthcare Equity. My name is Priscilla. My pronouns are she, her. Today, we're going to be discussing mask mandate changes, vaccine verification changes, what that means for us, and how we move forward. I will be putting a link in the chat where you can find previous recordings of these sessions, as well as this session will be uploaded. Feel free to share this with your family and friends. It will also be up on our UW Medicine YouTube channel. I will give this over to Dr. Chopra now for introductions.
Thank you, Priscilla. Welcome everyone to this edition of Community Conversations by UW Medicine. And this is our effort to get your questions to your answers and clarity on current COVID situation. Today, we'll focus on where we are in the pandemic, the latest masking and vaccine verification guidelines, and what can we expect in the near future. I'm Anita Chopra. I'm an internal medicine physician at UW Medicine Primary Care Shoreline. And it's an honor to have with us today Dr. John Lynch. He's Medical Director, Infection Prevention and Control, Associate Medical Director, Harborview Medical Center. I have Dr. Eric Chow. He's a fellow in Adult Infectious Disease, Division of Allergy and Infectious Diseases. And Dr. Chow's training includes Epidemic Intelligence Services at the Center for Disease Control and Prevention. We also have Priscilla Estrada, who is Communication and Workforce Engagement Specialist, Office of Healthcare Equity at UW Medicine. Thank you so much for joining us today, and thank you for your time, Dr. Chow and Dr. Lynch. Dr. Chow, let's start with you. And where are we today with regards to the COVID-19 pandemic? We hear that it's heading towards becoming endemic. When exactly is the disease endemic, and what are the differences between pandemic and an endemic?
Absolutely. Well, thank you so much for having me. And what an important question. And something that I think we're all thinking about, not only from a community level, but from a scientific and public health level as well. I think we're in a period of time where there's cautious optimism. We're seeing cases here in the United States, including locally, of decreasing case counts. But that being said, again, I say cautious optimism because we know that COVID-19 can really throw us a curveball. And so it's important to be vigilant. But I appreciate that question about what is the end of the pandemic, and what is oftentimes people will then ask, what is endemicity? And that's similarly something that we think about as well. So let me take a little bit of time to clarify how I think about these terms. So I oftentimes think about outbreak, epidemic, and pandemic collectively. And from a public health standpoint, what this means is that these terms are used when we see an increase in the baseline rates of an infection in an area. So in the case where we have a new infection that affects humans, that's very easy because previous to the pandemic, you don't see any cases, and now you see cases. So that's an increase in the baseline rate. And so as in the case of COVID-19, we saw an outbreak at a seafood market that then became a regional epidemic. And then after it was quite clear that rates of infection were going to increase exponentially and then affect different countries, the WHO, or the World Health Organization, made it their mission to declare a pandemic at that point to prepare people for the onslaught of infections that we saw early in the pandemic. Now, the term endemicity is slightly different. Endemic, or something that is endemic, can apply to not just infectious diseases, but obviously plants and animals. I oftentimes, to help people relate, I say that here in Washington State, pine trees are endemic to Washington State. And from an infectious disease example, I also say that malaria is endemic to certain regions in Africa. So basically what that means is that in an infectious disease such as SARS-CoV-2, or the virus that causes COVID-19, becomes naturally occurring in a particular area and becomes part of that respiratory virus milieu that includes influenza, RSV, seasonal coronavirus. And so that is what we predict is likely going to happen with SARS-CoV-2, that it will become part of this circulating group of viruses.
So that means we are heading towards endemicity. Is that right, Dr. Chow?
That is what the data is suggesting. And so basically what that means is that we have to learn to live with the virus and that the virus will continue to circulate in our community. And it's becoming, unfortunately, less likely that the virus will disappear from the community on its own.
Thank you. Dr. Lynch, if this is heading towards endemicity, then does it mean that it's not dangerous anymore?
That's a fantastic question and follows up on Eric's response. I'll do my best here. Again, yeah, so I'd like to also echo, thanks for having me on today. I really appreciate the opportunity to talk to the community about these really important questions. So I do think that a lot of times people think of when a disease becomes endemic, that it is no longer dangerous or no longer of concern. And what I come back to is that it's just the opposite in many ways. Just because a disease is endemic does not mean it doesn't continue to cause harm to people and often times lead to really terrible outcomes like death. In the world, there are lots of endemic infectious diseases. And this is part of the challenge, particularly here in North America. When we think about endemic infectious diseases, we often think about diseases happening someplace else. Things like tuberculosis, measles, polio, Ebola, right? They're things that happen all the time in other parts of the world. We have endemic infectious diseases here in the United States, like influenza, like RSV, like lots of other things that Eric spoke about. And as we move into this phase where we're going to be seeing COVID-19 indefinitely in different ways, shapes, and forms, it is still going to cause a great deal of challenges for us, a great many challenges for us. It's going to cause harm to people. Sometimes that harm is going to be keeping them away from school or from work. Sometimes it's going to end up, they're going to have an emergency department. Sometimes they may end up in the hospital, ICU, and unfortunately, it is going to contribute to deaths in our community, exactly like influenza has, and RSV, and many other respiratory viruses and infectious diseases. So I think my message here is when a disease becomes an infectious disease becomes endemic, it doesn't mean that that's, good overall. It's better than a pandemic where we don't have control and it's over the entire globe. But what it means is now we're sort of wrestling with it on a day by day, week by week, and month by month basis. And the impacts of it can still be quite terrible, just like we think about flu.
Thank you so much for explaining it so simply, Dr. Chow and Dr. Lynch. I think it's very important to remember that COVID is still here. It's not gone. It's still here, but like you said, we have to develop ways to wrestle with it. And at this point, Dr. Chow, I would like to touch upon the vaccination issue. A lot of people are delaying their boosters because they think that things are calming down and they may not need it anymore. What should they be doing? Should they delay their boosters or should they go ahead and get their vaccines?
Thank you. I think that's such an important question, and I know that I answer this question for people who come to see me in clinic. And I know that, so let me take a step back and just say that one of the most remarkable things that happened during the pandemic was the development of safe and effective vaccines, and the science, the rapidity at which we were able to match the science to see how well these vaccines work at subsequent stages of the pandemic. And we learned a lot over the last year, and it was quite clear that based off of the data that in addition to the completion of a primary series, a booster was recommended, particularly when we start to see the more infectious transmittable Omicron variant that came about. Now, that being said, again, I stated that earlier that there was a cause for cautious optimism, but the reality is that you never know when you're going to have an exposure, and that there is a very real risk of community transmission that is ongoing. So the recommendation remained, and this is from the CDC level on downward, that we recommend getting the booster when it is appropriate for your timeline in the series of vaccinations. The best time is now, if that fits in your vaccine schedule. And so that is the best way, again, to protect against the severe disease, the severe consequences of severe disease of SARS-CoV-2. But also, it's important to think about the other aspects of SARS-CoV-2 as well, such as long COVID. And we're seeing more and more data where vaccines can help mitigate the risk of long COVID as well.
So I think if you are due for your booster, please go ahead and get it. Please don't delay it. We do see a lot of long COVID and it can be very devastating and disruptive. So you want to avoid that if you can. Dr. Lynch, let's talk a little bit about the mask mandates, the changes in the mask mandates, and there's a lot of optimism. People feel free, of the bondage of face coverings. But one of the very important questions that the community raised is, what kind of healthcare data went into the decision for lifting the mask mandate? And we are still in the midst of the pandemic. Why could it not have waited? Why now? And what has changed? And what should we be doing?
Yeah, thank you. It's a really important question. And if you don't mind, I might actually tag team with Eric on this one because it's complex. And, when we think about all the information that goes into mandates, public health requirements, there's a lot there. Even the questions you've already asked around things like endemic and pandemic, to some extent, they have a social part to them, right? It's not just a scientific decision that you get past X, now you're gone from a pandemic to endemic. A lot of it is what we want, what we value as a society. And that goes into public health requirements as well. So the two things that have changed recently, right, is one, the required vaccination or testing to go into some indoor public spaces, and the masking requirement just recently. I would say from the quick one, the vaccine testing requirement, we know that was really about a social desire to get more people vaccinated, more time to get more people vaccinated, particularly through the Omicron surge. And I think that as a tool worked really, really well, right? It was sort of a social decision to support vaccination across our population. And in King County, we've seen that work extremely well for us. But over time, right, especially as that surge, we move past that surge, the benefits of that haven't, no longer are as much in play. In addition, businesses and other places were having a lot of difficulty actually forcing it to continue. So at some point that becomes a decision that just doesn't really work anymore. It's not serving its main purposes. Similarly with masking, we know that as Eric pointed out, our numbers are coming down quite a lot, right? So if we look at our case rates, we look at hospitalizations, we look at deaths due to COVID-19, those are coming down. And we need to use those data as well as sort of our social milieu, all the different stakeholders to make these decisions. As numbers come down, the real risk of getting COVID-19 in the community does go down. The tension I think we feel around this is, what are those numbers we're using? And recently with the transition from sort of an old 4-part or 4-level CDC, high, substantial, moderate, low transmission rates, those were really built on like Delta and Alpha. Remember all those different Greek letters we were having, where getting infected had a very high rate of making people very ill. We saw that sort of disconnected a bit with Omicron. How disconnected, not entirely clear yet, but a lot of people with Omicron had very few symptoms or no symptoms. And it didn't put as many people in the hospital proportionally. Some estimates say that about half the US population got Omicron, which is absolutely remarkable in this last surge. So when you look at sort of that disconnect, and those numbers coming down and the high vaccination rates we see in King County, it is pretty rational to think that we can probably go into many public spaces that have made accommodations to improve their environments, better ventilation and all these sorts of things, staying home when you're ill, access to testing and so forth, all together make it pretty reasonable. The other half of that, though, I want to continue to emphasize, and again, this is where I look to Eric a bit, is that we are a society. Society informs political leadership, and society has been telling us that they are ready, in many, not all, but many are ready to remove these masks. And we've seen an unfortunate, really unfortunate sort of division in our society around this idea of masking, which I'll just be very clear, has very good and abundant scientific data to support its use as what we call a non-pharmaceutical intervention, right? Not a pill or something. It's something we can use out in public to keep us safe. So I would say that's sort of the broad approach to this. The thing that I think we may be missing on this, I think my colleagues in public health are out. We're so lucky in King County to have outstanding public health folks and at the Department of Health at Washington State. The thing that I think may be challenging here is that we as a society need to be very ready to go back, to reinstitute those things should things change in the near future. So, I think that part is might be a little bit more of a challenge as we roll this back. But I think we need to maintain the idea or be ready to move back to those interventions. And if you don't mind, Dr. Sherwood, I wonder if Eric could maybe comment on this as well from his public health perspective.
Absolutely. I completely agree with everything that you said. I would say another way to think about it is that, the CDC works with obviously all the state governments, local governments, trying to understand risk and hospital capacity as well to be able to provide the care that people need. And, we're, again, cautiously optimistic in a position where cases are going down and many more people are vaccinated, many more people are boosted. And as such, a one-size-fits-all approach is no longer necessary, and that various locations, either states or county level or even business level or personal risk has to be taken into account. That varies from individual to individual, business to business, and locale to locale. So as such, it empowers these local people to be able to make those assessments on their own, dependent on whether they're able to provide the adequate ventilation, who are the groups of people that they are serving, et cetera, et cetera. And then also, of course, there's the personal understanding and personal responsibility to take precautions where you need to consider your own personal risks. So that's the only other thing I would add.
Thank you so very much. And I think what you said, it is so important that it's not only the mask mandates changing, there's also your individualized risk. And it is okay if you don't feel comfortable taking off your mask. And I think, Dr. Lynch, what you said about the divide between people wanting mask and not wanting mask is huge now at this time. And one thing that is brought up is that some people who continue to mask, they are sometimes questioned or shamed as to say, and I think that it's very important to address that it is okay if someone feels comfortable keeping their mask on, and I think we should respect people's choices. Staying on the topic of masking and unmasking now, Dr. Chow, what do you expect to happen? Will the cases go up? Should we expect COVID and flu cases to go up since the masking is now not that, not being endorsed that much?
Yeah, that's a great question and something that we're studying very closely through either various research studies or community surveillance. And it's something that we're interested in, obviously, to inform future public health recommendations. But as you might expect, along with a change in mask requirements, people's health behaviors are likely to change as well. It's not single-handedly just about masks, because people will also feel more comfortable to travel, people will feel more comfortable to socialize. So those things together collectively will likely increase exposure, increase risk, not just for COVID-19, but other respiratory viruses. So to answer that question, I would say yes, I do expect those numbers to go up. Whether that translates into increasing proportions of severe disease and death, it is not quite clear, but I think that just by virtue of our understanding of how COVID-19 and other respiratory viruses spread, I do expect numbers to go up.
So we do know that masks work, and they are probably the most important non-pharmaceutical intervention that we can do to prevent, getting infected. At this point, Dr. Lynch, what would you do? We know about the public health guidelines. What would you do? Would you be comfortable taking off your mask, or what do you plan to do?
Yeah, so that's a great question, and I'll share with you my own approach to this. But I do want to add one more part, to follow up on Eric's points, and I think it's connected to this question. I do think that one of the challenges that's out there that we may be missing on the sort of the public health messaging is this, I agree with Eric around this individual sort of assessment, right? The challenge is that I don't think everyone has the tools to make those assessments. If they're think it's not a good idea, that's like, yeah, that's sort of the idea. But looking at numbers, looking what's coming down the track, density, filtration, right? Not everyone has those things. And so I have a lot of those things. And so I'm able to make lots of risk assessments on where I go. I go to a limited number of places. And I'm also very cautious about things, to be honest. I also live in a household of 4 people where everyone's vaccinated, everyone's boosted, no comorbidities and no immunocompromised individuals. So, with that sort of lens, when I go into basically any public place, I'm wearing a mask. And it's partly for me, although I'm not super worried about me. I'm just thinking about those around me. I want people to I don't want to give anyone COVID, right? I may be asymptomatically infected. I may have pre-symptomatic COVID. I don't want to give anyone COVID. But I also want people to feel comfortable, especially the people wearing masks. They're wearing masks because they want me to be safe, or maybe they're wearing masks because they're worried about their own health. And I want to respect both of those situations. And, I'm a community-minded person. I want to support the community. I want to support people who are wearing masks for whatever reason they're doing it. And so I wear masks in grocery stores. I wear masks when I go to a gym pretty regularly. I will say though, because I want to be absolutely transparent, I went to a small gym. I like to climb indoors. I went to a small climbing gym on Sunday morning, and there was no one there except for me, a couple other parents and their kids. The garage door is open. I'm able to assess ventilation. I know those people, and I did take my mask off for a period there. And so I was able to make that risk assessment, and as were my friends and knowing their kids. And, in those situations, I feel very comfortable doing so. So, the main message here is that I think people should feel comfortable wearing masks. I continue to wear masks in public spaces in very controlled circumstances where I have a lot of information. I do think it's, looking at the data that's out there, it's reasonable to take those masks off in certain circumstances.
Dr. Chow, would you like to weigh in on this? Would you continue masking, or what would you do personally?
Absolutely. I appreciate this because I think sharing our own perspectives is helpful for other people to assess the situations that they are confronted with. For myself, similar to Dr. Lynch, I will continue to wear a mask outside. I personally choose to use a double layered mask, where I use a surgical mask on the bottom and I use a cloth mask on top. Again, my goal is to form fit around my face to provide myself the best protection. Because the reality is that when I go to the grocery store, if I can't socially distance from other people, I just never know when my exposures might occur. But also, to be fully transparent, when I'm outside at the park, when I'm walking my dogs around the neighborhood, where I know I'll have the ability to cross the street and to socially distance that way, I don't wear a mask. But I do always carry a mask with me so that when those opportunities or when those situations present themselves, that I'm able to protect not just myself, but the other people I come in contact with.
Dr. Lynch, the other question that we got from the community is, if now with folks taking off their masks, for those who want to continue masking indoors, in crowded spaces like gyms or like libraries or grocery stores, what mask would you recommend that they use? I know during Omicron, we were talking about the KN95 and N95. Is it still the same recommendation?
Yeah, I mean, I think in general, the same recommendations continue to hold, right? We know what works. As you kind of go up that sort of ladder or tiering of masking, the more protection you're getting in both directions. And I think, like Eric talked about, having a 2-layer mask is great, allows you to use those cloth masks with all the great decorations and personalizations over the medical mask underneath is great. To some extent, I have a lot of K95. So I actually have mine that I wore in this morning. This is one that we have, boxes of in my house, and they're very comfortable for me. They fit me really well, and I continue to wear those. And they fit in my pocket. So this is what we're using. My kids tend to use more of the medical masks. The ones we have at home fit them really well, and they find them easy to breathe with and so forth. So this is what I'm using. You'll see me out there with this on. In part, it has to do with just that's what I stocked up on. That's where the data are. They're comfortable for me, and I know that I'll wear them.
And the fit is very important. So it's very important for you to have a good fitting mask.
Yep.
Dr. Chow, there's a lot of debate about when the masking going off in schools, especially because the younger kids are not vaccinated. What would you advise parents, who have kiddos in elementary or middle school, or what would you advise them about the classroom, about lunchtime, about eating safely, and about play dates in the playground, as well as meeting outside of school? What would you advise them?
Yeah, no, what an important question. I know that this is an area of a lot of consternation for parents out there, particularly with the big changes that we're seeing with the masking requirements and such. And, again, we continue to assess the situation as the pandemic evolves. Personally, I do not have children myself, but I certainly have a lot of loved ones who fall in that age category where they're not yet eligible for vaccination. And so let me tell you what I tell them. And I think the reality is that if the child is able to wear a mask, I would encourage them to do so as much as they can. Because, again, you're trying to prevent transmission, infection in that young age group, but also, within your families and your households, there may be other people who are at risk for severe disease, and we want to mitigate that as much as possible. So I try to think about it holistically. And again, each individual family household's risk factors may be a little bit different. So it's also worth a discussion with the, individual's physicians about additional recommendations that can help mitigate infection. But we've come a long way with regards to the pandemic as well. We've had a lot more people in the community who are vaccinated. There's still a lot of people who are wearing masks, which is great because, again, it doesn't just protect against infection for yourself, but other people. And we have a lot of other tools available to us that helps mitigate severe disease when it does occur. The other thing that I think is very helpful for parents who are oftentimes thinking about these things is to have a very productive conversation with a pediatrician, because they can help inform you about the unique underlying conditions that your child might have that might be important for you to develop a game plan for if they were to be exposed or were to develop an infection, say if they qualify for a particular medication that can help mitigate disease. And so I always find having that thought process laid out, having my algorithm in my head is very helpful. And I know that not everyone may be able to make that assessment for themselves. So it's always helpful to have that conversation with your physician. And they're equipped to be able to answer this, because we have to think about this day in, day out for people.
I think schools are also supporting families and students in every way they can. And I think they are really, educating the kids as well. And those who do want to continue masking can, comfortably do so without any stigma attached or without, being pointed at as well. Dr. Lynch, jumping on to the vaccines. The vaccine verification has changed. And however, we do recommend people to go ahead and get their boosters if they are eligible. What about the fact that we are hearing about the 4th dose of the vaccine? Who should be getting the 4th dose?
Yeah, so again, I'll try to keep it up to date here because things move so fast with all of this information. Right now, so just to be clear, 4th doses are recommended for people who fall into certain immunocompromised statuses, right? And hopefully those individuals have been having discussions with their providers. For otherwise, teens and adults, it's still 3 doses. You may have heard in the media that at least one of the vaccine manufacturers is recommending a 4th dose and has applied to the FDA for authorization to actually market that. As it stands right now, I'm not so sure they have the data to actually make that 4th dose recommendation. And again, we're looking to our colleagues in the FDA and at the CDC, what's called the Advisory Council on Immunization Practice, to evaluate those data. And as you may have just remembered, one of those companies put in a recommendation for vaccinations for under 5, and they actually looked at the data. They said it's not there yet. We're going to hold off. We need more information. And so again, they've been making excellent decisions throughout this pandemic. And as it stands right now, we'll see what they have to say. My personal review of some of the data is that we're not there yet in terms of that recommendation. And so, we'll see how it goes. I do want to, and I think Eric may have said this as well, is that we know that, being vaccinated, getting the 2 doses, the mRNA or J&J, carry a lot of protection against all the different variants we've seen, including Omicron. Getting that boost buys you more protection. And, if you're looking for like data, the Public Health Seattle-King County website has a dashboard. It's really easy to find, and there's a button there you can click on the impact of vaccination, both getting the 2 doses and or getting the boosted versus those who are not fully vaccinated. And I'll just tell you, every time I look at it, I'm just amazed at the impact of vaccination across age groups and its ability to protect people.
Dr. Chow, one cohort that feels really left out is the kids under 5, and we still don't have a vaccine for them. What is it? What stage are things looking at, and when should parents who have younger kids expect the vaccine to be out? This is part one of the question. The second is, for those kids who are not immunized, who are younger than 5, is it very important for them to mask?
Yeah, that's again, a really great question. And, it goes back to that area where I know that an area of consternation for a lot of parents who have that younger age group that they're trying to protect. They've already taken the personal responsibility of protecting themselves and as best as they can the other family members, but this age group remains in a group of individuals who are not yet eligible for the vaccine. As you heard from Dr. Lynch, there's a lot of data that's still being evaluated about the vaccine. We want to make sure that when a vaccine is recommended, it's both safe and effective. And so a lot of people weigh into that, a lot of really smart people, a lot of experts in the area who have done this for many other vaccinations. And so they want to make sure that at the time that a vaccine becomes available, that both those criteria are held up. And so we're not quite at that point yet. And so there are a lot of things that, they have to weigh before that rolls out. So the timeline, unfortunately, is not yet known. And so, again, this comes down to a lot of the other tools that we have at our disposal to make sure that we best protect this younger age group, right? It comes back to the things that we do have available that protects both us and our young ones. And that includes masking, and when you're not able to social distance when you can, and also if you're an indoor place where you have control over the ventilation, increasing the airflow, that's all important. I know that there's a lot of movement towards, seeing other people and, seeing loved ones that you haven't seen for a while. Those are things that you'll probably have to weigh in terms of your assessment, how important those things are, understanding that your young ones are still unvaccinated. So there's no easy answer to this. And I think that, but at the same time, there are a lot of tools that are not vaccinations at our disposal that we can do that are very effective at preventing infection in this young age group.
Dr. Chopra, can I just add a little bit to this as well? Is that, and I think Eric did a great job of explaining this, but I just want to think, as he was speaking, I was sort of thinking about another way is that, we all want to be in our lives like we were in 2019, right? Everyone does. And some people are acting that way right now, right, in their lives. They've made their own risk assessment and they want to be like they were behaving in 2019. But for a lot of people, those who chose to wear masks, those who are choosing to get boosted, those who are continuing to limit their social interactions, right, are sort of, between where we have been, where you were staying home, working from home where possible, and so forth, not seeing your friends, not seeing your family, not going to school, right? We're in between that someplace. And I think, at the family unit level, we all have to find kind of where our families fit along that continuum. I As I've said, I wear masks, I'm boosted. My kids and I pay attention to our symptoms. We get tested if something's going on. We are not acting like it's 2019. We are not going to big parties. We are not going to, big concerts or other things like that. So we're on that continuum. And when I think about those with, 4-year-olds, 3-year-olds, 2-year-olds, they're going to probably be a little bit more on the conservative side of that continuum in all of this. And I want to recognize that it doesn't feel fair to those families, and it's not. But it is where we are until we provide those youth with the tools that the rest of us have. And when the first question you had out there around endemicity, to me, think about endemicity, I think about equitable access to vaccination across the age spectrum as being a key part of moving towards sort of that societal understanding and acceptance of this awful infectious disease. And so I recognize that discomfort. I want to acknowledge that it feels unfair, and it feels that way, and it's because it is.
I think that was so helpful, and I think a lot of parents, and we got, as you see in the Q&A as well, questions about kids under 5 years of age. I think it's we do acknowledge that, and it's really, really important to recognize their struggle every day when they are sending their kids to school. There's that fear that they may come back with the infection. Dr. Lynch, regarding the adult vaccines, do you expect that this will become an annual recommendation, that people will need boosters annually?
You guys are asking all the really great questions, all the good questions. And I'll tell you what I'll say is I don't know. I do not know whether we're going to require additional boosters. Would I be surprised if it becomes something like an influenza vaccine? I don't know. I would not be surprised at all if we needed another booster out sometime in the future. Do I feel like right now I need to be boosted? No. I think the data we have right now supports me as a boosted individual at this stage of the pandemic is being highly protected. But 12 months from now, things may be different. We also have to recognize it's not just about our immune response and the what's called the durability, the duration, how long we have those high levels of immunity that may protect us from infection or hospitalization or worse outcomes. The other part of this that I think is really, really important is that think about the vaccine and it's everything it does is one piece of the puzzle. The other piece is what is COVID going to do? So the virus that causes COVID-19, SARS-CoV-2, continues to evolve, right? I'm not sure if we're going to have any questions about this, but it continues to change. And we do not know how fast it's going to change. We do not know whether there's going to be new variants of concern, and those things impact vaccination status. And so they're kind of like a cycle. And without knowing how the virus is going to evolve, it's hard to really tell us what we're going to need to know about additional vaccine doses.
Thank you. Dr. Chow, we are hearing about the rise of the BA.2 variant, and we hear about cases in other countries. What does it mean for us here? And what do you expect the summer to look like, and especially the fall to look like?
Yeah, great questions. Again, also questions that we don't quite yet have the answers to, but let me tell you some of the things that we're considering. One of the things that's quite a stark reminder about the pandemic is that our geopolitical borders are invisible to infectious diseases, and they will cross borders very readily. And so what happens in some places may affect others. That being said, it's not quite clear whether what the cases that we're seeing in Europe or China will translate into a reflection of what we'll see in cases here in the United States. But that being said, so long as there is virus circulating in the community, there's always the chance for new variants to form and change the way the pattern of the pandemic as we see it now. Specifically the BA.2, so that's a great question and an area of study that is of interest to me. Let me tell you a couple things that stand out to me about the BA.2 variant. So for those people who do not know, BA.2 variant is a subvariant of Omicron. So falls under the category of Omicron. And what we've seen is that it seems to be more transmissible, meaning that one person can spread it more easily to other people. And I think part of the reason is that the incubation period is slightly shorter. And what is the incubation period? That's the time from exposure to the time you develop symptoms or infection. And so before you're even able to make those changes to your own health behavior, you may have already transmitted. So it makes it very, very challenging. So that's one of the things that we're watching. And the other thing that we're looking at a molecular level is just like Omicron had taken over Delta, we're seeing a shift in the proportion in infections from the original Omicron variant slowly heading towards more BA2. Whether BA2 will become the predominant subvariant, it's not clear, but we are watching that very carefully and trying to better understand what is the meaning of that and how that might change our pandemic outlook.
Dr. Chow, what do we know about testing for the BA2 variant? Are the home antigen tests effective at detecting the BA2 variant? And how about the PCR testing? Can you talk a little bit about the home test specifically?
Sure, absolutely. I think it's so great now that the home testing has now become available to a lot of people. And just in case people are not already aware, you can order your test to be delivered to your house either through the federal government or locally. But that has given an additional tool to people at home who are trying to make decisions about what they do in certain situations. So that's been a huge advance in terms of the pandemic. And obviously, whenever there's a new variant and some sort of change in the virus, not only are people at home asking this question, scientists are also asking this question. In fact, the FDA, who governs which tests are permissible and which are going to be most effective at detecting this, are also monitoring this. One tool that I encourage people to take a look at is that the FDA actually has a list of all the available antigen tests that are available out there. And they're constantly monitoring, making sure that it remains sensitive and specific to their standards that people are using at home. That being said, I want to just emphasize that like any other test, antigen tests are imperfect. And one of the limitations is that we don't know that it's less able to detect early infection. So say, for example, you had symptoms of COVID-19, but your antigen is negative. That might be a consideration for pursuing a PCR test, which is more sensitive. With regards to the BA2 specific variant, to my knowledge currently, is that most of the antigen tests are still readily available and still work as effectively, but that constantly is updated and assessed by the FDA. I don't know if Dr. Lynch has any other thoughts or any other updates that I'm not aware of.
Nope, I've heard the same things around the antigen tests. While there are significant differences between BA2 and BA1, the parts of the virus that the antigen test look for are pretty much the same. And just on the PCR side, right, the laboratories doing that work are continuously looking at what they're finding, tweaking their assays to maintain the same very high level of sensitivity. So I feel very, very, very confident in the PCR platforms, and I think the antigen tests continue to work very similarly as they have for the last 6 months to a year.
So Dr. Lynch, there's a question in the Q&A. If someone got Omicron in the past month, how likely would they be to get BA2 infection?
Well, as it stands right now, it looks pretty uncommon or pretty unlikely. So while BA1, kind of the one we saw in January, and BA2 are actually, if you take their whole genetic structure, they're actually quite different. Where they are the same is on the outside, on what's called the spike proteins. They're somewhat different, but they're pretty close. And what's really important about the spike protein is that that's where the virus binds to our cells in us. And that's also where our immune response is targeted. So the immune response we would have to Omicron BA1 would very effectively deal with Omicron BA2 as it stands right now.
So if it's more transmissible, Dr. Lynch, then for people who want to continue masking, I think it makes sense, to be on the, side of caution, because it's still there and it's looming on the horizon, and it, could be a predominant strain here at any time. One of the questions that the community would, they're asking are, is it safe for kids to have play dates indoors? And would you like to weigh in on it, Dr. Chow? Is it safe for kids?
This is great. Eric's getting all the pediatric questions. These are the hard ones.
Background. Yeah, absolutely. This is, again, one of those, I actually very much like the way Dr. Lynch had discussed the spectrum of risk earlier on. And I think that's a nice way to kind of frame our individual thinking. Again, play dates are certainly something that we would like to move towards. It's great for our children. It's great for them to make friends. I think there are a lot of benefits. But at the same time, risk for individual families may be very different. But I think that being said, I think that we do have tools at our disposal that can diminish the risk for indoor play, such as where it's possible, you can open windows, increasing ventilation, and where possible, and where there's likely going to be a lot of close contact, then mass, I think, is still encouraged. Obviously, we'll have to continue to weigh the scientific data and take a look and see how things move forward in terms of community cases as well, that might also help influence people in their decisions to allow for indoor play. I don't know if you guys have any other thoughts.
Yeah, I mean, I think that when I think about my two children, I have two daughters, ages 12 and 15, and we're making very slow increases to what, remember the bubble, our pod. We've sort of maintained that. We've had the same sort of couple of families we've had throughout the last couple of years, and in terms of our home lives, right? Go into their homes, come into our home lives. We've shared our risk approaches. We have shared approaches around vaccination, boosters, and similar. We're slowly increasing that sort of bubble. We're moving along that continuum of risk a little bit because, again, I'm very fortunate in that the 4 people in my house are all vaccinated and boosted, and we don't interact with immunocompromised people in our own families right now. So, I just take an example. Obviously I work in a hospital, so I continue to mask with 100% of people here in all my spaces because I want to keep much higher risk here. But out in the world, I think that gradual sort of increase as the numbers go down. I do want to just go back to one comment in a minute on this, Dr. Chopra. I'm a little bit more the continuum of optimism, pessimism, a little bit more towards concern around this BA2 than Dr. Chow may be. I definitely think BA2 is going to take over BA1, and that's going to be the predominant strain going forward. And I'm a little bit concerned about in countries where we're seeing that same trend, a bump up in the hospitalizations, which is, importantly, part of our community risk level, the way the CDC and public health is looking at it. So it's something I'm definitely keeping a close eye on. But for the moment, right now, I'm letting my kids do a little bit more than they did before.
And then, Dr. Lynch, on the same over the same topic, what about going out to restaurants and gyms, because you don't know if other people are vaccinated and boosted? What would you advise people who are, getting together in groups and meeting in a restaurant and eating there? What would be your suggestions about that?
Yeah, well, I already say I go to a gym, so I'll be clear about that. Gyms, and I think this may even come from Dr. Duchin, who's our health officer in public health county. He's like, gyms tend to have really good ventilation because otherwise they would smell terrible. So I go to just a couple of gyms. They're called climbing gyms, rock climbing gyms. And I actually know very well, because I've spoken to the people who own those gyms, how good the ventilation is. Like, I know how it works in there. These are really high ceilings, big open kind of industrial spaces. And when there's a lot of people there, I wear masks. When there's very few people, extremely few people, where physical distancing is very, very easy and there's good airflow, I feel less compelled to wear a mask. So that's my sort of gym approach. To be honest, I haven't eaten in a restaurant since 2019 or January of 2020. So my wife and I are sort of talking about it. There's we miss a couple of types of food that just don't fly at home or for takeout. And we're in negotiations. We're thinking about it, trying to figure it out, but we're not quite there yet. And again, I don't have a number or a threshold. Maybe when we get to low moderate, we're going to feel pretty good in terms of our case transmissions. But again, it's a still open discussion. So can it be done safely? Sure. But again, in a restaurant or bar that's got space, that's got, maybe has that outdoor area, has something else, it's not dense, that may be our first foray. We go early, right, before everyone comes. That sort of thing may be our first foray, but we're not quite there yet, to be honest. I don't know, Eric, what you're doing.
Yeah, I'll share my experience. Eating in restaurants was a big part of my life before the pandemic, and certainly something that I miss, and I certainly is a priority as we move forward in the pandemic. And so again, I know that I'm equipped with knowledge about various risks in particular areas and places that I've eaten before. I know like what their ventilation might look like and how many people generally fit in a small space. But that being said, I have made small strides towards eating in restaurants again, and starting off with restaurants that I know where I can socially distance from other tables, and that where I know the personal responsibility of the restaurant itself is to maintain as good of public health practice as possible. And one of my strategies that I use is I eat really early, again, to enjoy that experience before other people are in there. So again, not just to protect myself, but to protect other patrons who are coming in later. So, at the table, other small things that I do is I continue to wear a mask except to eat and drink. And not ideal, not the best case scenario, but again, eating out is important to me. So I do allow for those specific scenarios.
So I think just assessing your risk and just making sure that you can trying to control as many variables as you can. Dr. Chow, one of the things that both of you talked about is ventilation. What are some of the ventilation measures? Ventilation being one of the pillars of non-pharmaceutical intervention, along with masking. What are some of the ventilation measures that are recommended by the public health, and especially for small businesses and such, that people should be aware about?
Yeah, that's a great question. And again, I think ventilation is probably different aspects of ventilation will be different for who's asking the question, right? Businesses will be different from, say, like individual people at home and such. I think one great guide is that when you type in CDC and ventilation for COVID-19, they give you a great example, a great list of things that you should consider for your individual circumstances. But that being said, in general, where possible, obviously increasing airflow is trying to get rid of suspended particles of virus is the goal here, right? And you can achieve that through, I think, different strategies. One of the easier strategies, certainly as the weather gets warmer and where possible, if you can open windows and increasing airflow, that certainly is a great strategy that doesn't require purchasing of extra materials. Businesses and such, I think it's always important to assess what type of ventilation system you have and making sure that it's well maintained, and making sure, particularly those air filters that sometimes I admit, even for myself, I forget to change, but making sure that those are appropriately changed on a regular basis will certainly enhance the efficacy of individual ventilation systems. Other things that people consider, where maybe ventilation is not under your control, but you would like to have additional ventilation in your space, you can consider portable HEPA filters, which can also enhance the filtration of the airspace that you're working in. So those are some of the considerations that I often think about, but I also am fortunate to work in places where those things are thought about quite often.
Thank you so much. This has been such an amazing discussion, and especially about masking and vaccination, and what to expect in the near future. Thank you so very much for your time today, and thank you for making things so simple for the community. I really appreciate having you today. Thank you so very much, Dr. Lynch and Dr. Chow.
Thank you for having me on. Really appreciate it. It's been great.
Yeah,
Thanks
thank you.
everybody
See
for
you all later.
joining. Again, the links are in the chat if you'd like to share this video out to others. Thank you again for our panelists, especially the transparency. I think that's really appreciated in the times that we're going through right now, and those personal examples I think are really helpful. So thank you. Stay safe and healthy, everybody, and we will meet with you soon. Thank you.
Bye.
Bye-bye, everyone.